So today we have a specialist on chromosomal disorders. Her name is Dr. Erica de Torres, and she is talking to us about Down syndrome.
So, can you tell us what is Down syndrome?
Hi there, and thank you for having me on your show. Basically, Down syndrome is a chromosomal disorder that was discovered by John Langdon Down in 1866.
So what are the causes of Down syndrome?
Good question. Basically, it deals with chromosome 21. Either there's too many copies, there's too little copies, or it's stuck to another one. And there are all different names for those types of chromosomal disorders. So basically, I'll go through them one by one. The first one is called trisomy 21, which means that there is an extra copy of chromosome 21. And then the next one is called mosaic Down syndrome, which means the Down syndrome chromosome 21 is broken. And then the final one is called translocation, which means that the chromosome 21 is stuck to another chromosome.
So what are the symptoms of Down syndrome?
That's an excellent question. Basically, people with Down syndrome have really significant characteristics that set them apart from the other people in society. Some of those symptoms include a decreased muscle tone at the birth, an asymmetrical or odd-shaped skull, a round head with a flat area on the back of their head, a small skull, slanting eyes, a small mouth with a protruding tongue, broad but short hands, a single crease on the palm, retarded growth and development, delayed mental and social skills, white spots on the iris of the eye, and finally, poor muscle tone and loose ligaments.
What are some tests that a wife and husband could take in order to determine whether their offspring could have Down syndrome?
So there are different types of diagnostic and screening tests. There are two major different screening tests, and one of those is called the expanded AFP test, or alpha-fetoprotein test. It is basically a blood test taken between 15 to 20 weeks of a woman's pregnancy. The second major screening test is called the neutral translucency screening test. It's basically an ultrasound taken when a baby is 10 to 14 weeks inside the woman's uterus. Next is the amniocentesis test, which basically puts a needle in the woman's belly through to the uterus and gets all the fluid out to check if there are any different fluids inside her uterus that can be harmful or result in a disorder-like function for the baby. Finally, another diagnostic test that a woman can take is called the chorionic bilious sampling test, which basically takes the placental tissue and tests it. And finally, an ultrasound could probably do the work.
Are there any ways you can prevent Down syndrome?
That is an excellent question. Well, actually, for this disorder, I am afraid to say that there is no prevention system. So that means that there's really no way you could stop yourself from giving birth to a child with Down syndrome. However, if you really did want to take that course of action and you knew that your child was going to have Down syndrome, you could always abort it. There's also genetic counseling, which deals with the fact that a woman at a certain age has a higher risk of getting Down syndrome, and in this case, the counseling professional would tell them what their risks are, and they could think about that and see if they're still willing to have a child.
Are there any treatments for Down syndrome or anything?
Well, sadly, there is no cure for Down syndrome, but there is treatments for the health conditions that most people with Down syndrome do suffer from. Like, for example, if someone has a heart condition, they could always get their heart checked, and it is suggested for many people with Down syndrome to get themselves checked every now and then to make sure that they are healthy. Also, there's special schools that help people with Down syndrome become educated, and there are also physical therapy, emotional therapy, and speech therapy that help people with Down syndrome to lead a successful life.